Hello everyone, my name is Demissie Solomon and thank you for joining me today. I want to express my deepest appreciation to my wife, Dista Regan, and to my three children for their unwavering support, patience, and encouragement throughout this doctoral journey. I'm also sincerely grateful to Dr. Boniface Stegman, my DNP chair, for her consistent guidance and leadership, and to Dr. Dewan Matz, my second reader, for her thoughtful support. My appreciation extends to my community partner, Dr. Tasfai Fanta, and his staff at the practice site, whose collaboration made this project possible. My project title is Tackling the No-Show Challenge, Enhancing Patient Attendance in Primary Care Setting in the Southeastern United States. This work focuses on addressing the persistent issue of missed appointments and their impacts on continuity of care, patients' outcome, and clinic efficiency. I'm honored to share the result of this quality improvement initiative with you on this presentation. So my committee chairs, Dr. Bani, readers, and the community members as you see on this slide. Background and significance. Missed appointments or no-shows are a persistent challenge across healthcare system. Nationally, no-show rates range from 15 to 30%, and each missed appointment costs clinics an estimated of $200 in lost revenue and inefficiency. At my practice site, the baseline no-show rate was 34.4. That is significantly higher than national average. This issue is especially concerning in primary care setting that serve older adults with multiple chronic conditions. Missed appointments disrupt continuity of care, delay disease management, increase emergency utilization, and strain clinic workflow. At the practice site, staffing shortage contributes to inconsistent manual reminder course. Without a standardized system, reminders were often delayed or missed entirely. This created an opportunity for structured automated intervention to improve patient attendance and reduce workflow burden. So the aim of this project was to evaluate whether automated text message reminders delivered at 48 and 24 hours before appointment could reduce persistently high no-show rates. Literature review. The literature review strongly support automated reminders. As noted in this slide, systematic review demonstrates that SMS reminders significantly reduce no-show rate. Evidence also shows that reminders reduce disparities among high-risk groups and improve workflow efficiency when integrated into EMR system. Collectively, the evidence shows that automated reminders are low cost, scalable, and effective, making them ideal for primary care settings with limited staffing. Theoretical frameworks selected for this quality improvement project is the PDSA, Plan, Do, Study, Act, which is structured, iterative improvement, guided planning, implementation, and evaluation, ensured fidelity, and continuous monitoring. Method and the design. This project used a quantitative pre and post intervention design with retrospective EMR data. The key components include automated text reminder sent at 48 and 24 hours before scheduled appointment, daily fidelity checks to ensure the system functions correctly, standardized data collection tools to extract and categorize appointment outcomes, inclusion criteria, adult age 18 to 94 with scheduled primary care visits, exclusion criteria, patient under 18 or over 94 or non-English speakers are excluded from this project. The sample size included 475 scheduled appointments. All adult patients with scheduled appointment were included. Those are 241 pre-intervention and 234 post-interventions for the 4 weeks period. The data analysis. Data were analyzed using descriptive statistics to summarize appointment outcomes. The two proportion z-test to compare pre and post intervention no-show rates. Chi-square testing to assess significance. Cohen's H to measure the effect size. A power analysis to confirm an adequate sample size. So results, no-show rates in general reductions are noted. This slide shows the pre and post intervention comparison after applied the automated text message reminder. The pre-intervention, there is 83. The patient was no-show or missed the appointment, but after the intervention, that was 36 patient on the no-show. That reduction is like about 19%. Result: statistical significance. The results were both statistically and clinically significant. The no-show rate decreased by 19 percentage points after implementing automated text message reminders. The z-test showed negative 4.7916 with a p-value of less than 0.0001, indicating a strong statistical significance. Coherent H 0.2237, representing a small to medium effect size. The power analysis yielded 0.994, confirming that the sample size was more than sufficient to detect meaningful change. These reductions represent a substantial improvement in patient attendance and clinic efficiency. Staff and the patient feedback. Qualitative feedback from staff and the patients further supported the interventions. Staff reported improved workflow and fewer manual reminders called. The patient expressed appreciation for the reminders and increased responsiveness. Several positive unintended benefits emerged, including better preparation for appointments and fewer last-minute cancellation. So when it comes to limitation, the project had several limitations. It was conducted at single site, limiting generalizability. The short time frame may not capture long-term sustainability. The intervention relied on accurate phone numbers, which may not always be available because this place is providing service for adults and elderly. So most of them have land phone instead of the smartphone. There was no control group, which limits causal inference. Despite this limitation, the results align with national evidence and demonstrate meaningful improvement. The finding indicates that automated text message reminders are an effective strategy to reduce no-shows in primary care setting. These interventions improve workflow, enhancing patient engagement, and supports continuity of care. These results are consistent with literature and highlights the value of integrating digital tools into routine practice. For clinic with staffing shortage or high patient volume, automated reminders offer a sustainable, low-cost solution. Implication for practice. This project has several implications for nursing and healthcare leadership. It enhances continuity of care, especially for patients with chronic conditions, and reduces frequent visit of ER or hospital. It reduces administrative burden, allowing staff to focus on higher value of tasks. It supports health equity by improving access and reducing missed opportunities for care. For example, um, providing the preventive service, which are like mammogram, colonoscopy, diabetic eye exam, and diabetic foot ulcer exam. It demonstrated the role of the DNP in system-level leadership, quality improvement, and digital health integration. Conclusions: automated reminders reduce no-shows by 19 percentage points. The improvement was both statistically significant and clinically meaningful. The interventions is scalable, low cost, and sustainable. It aligns with national evidence and supports better patient outcomes. Future directions include long-term evaluation, cost-benefits analysis, and explorations of multimodal reminders such as email or app-based notification. Personal reflection: this project strengthened my skills in leadership, quality improvement methodology, and digital health integration. The DNP projects have enhanced my clinical, analytical, and system thinking abilities, preparing me to lead meaningful change in healthcare. So, in general, the quality improvement project on this topic, reducing the no-show rates in primary care settings, is very crucial and important, which is needed to be scalable, as you mentioned all in the previous slides. I look forward to discuss this project further and welcome for any questions, feedback, or suggestions you may have. I really appreciate for listening and give me this opportunity to present this project's final result. So I have listed here my reference, and thank you again